still doing hair
Yes.
transplants?
Yes.
And I mean, I don't know much about hair
I
transplants.
just coming back from the International Congress in Alaska 1 month ago.
Okay.
And the one before that was in Boston. We went to Boston. And the one before that was in Amsterdam. We went to Amsterdam. We have all the facilities to do it. Both techniques, by one or just with a strip. We don't have any problem to perform any of that two techniques. And for that, not all the doctors can do it. Not all the plastic surgery can do it because you have to be update, you know. And also you need the people and to train your people and also the facilities. When we perform hair transplant, it's about 10 persons involved during the procedure, you know. And we have a special area, almost 100 squares, meters squares, just for hair transplant. Special area to see. Have you seen that?
I think so.
Okay.
It's still the same one?
Yeah, same one. And we have we bought the best microscope in the market in Alaska 2 months ago. With special lights, no heat lights, but the people, our technician can see very well the follicles and can take care very close to them, cut them without any damage on them. And that's very important for this.
Okay. And that's, I mean, there's no risk with the hair transplant?
No, it's a very good procedure. I mean, we need just to explain to the patient that if we make one by one, you know, the percent of the hair that is going to grow from that technique is between 80 to 85%. Only that. And this, I'm telling you, is in the last Congress, they asking to the two best doctors in the world to doing that, only do that. One is in Madrid, Spain, and the other is in Finlandia, and they say this between 80 to 85 is gonna grow again. When you use the strip technique, but the way and the care you take preparing the follicles, the percent is to 90 to 95%, you know?
So explain the difference between the strip technique. You take
a small strip from here, we close the skin with special clothes, making that the hair grow between the scar.
Okay.
If you take all the hair out, you will see the scar, you know? But the more the people don't look that way. Normal hair, you cannot see the scar, okay? We take the strip, we close the incision, and that strip we cut it in small pieces, and the technician is cutting of them, making like slices, putting in the microscope, and separating the follicles, each by one, okay? And the other technique, we cut all the skin, all the hair, all of them. We cut all of them, and just we see like a 1 millimeter from here, and we use a special thing is cutting this way, and we're getting inside to cut this way, and then we pull it out one by one, you know. In the hair is going this way, and then move it this way. You get in this direction, but the root of the hair is not this direction, is a little bit here. You don't take nothing. That's why one by one is 80 to 85. And that's why the other one, if you are seeing the follicle and you're cutting the follicle, is 90 to 95%. For somebody that really needs as much hair they can, 10% is a good percent, you know? By one is just for very young patients that they use very short hair, don't want incision, and we can do it. Now, when we perform by one, we only do 1,000 by session, okay? Because it takes like 3 hours just to take it out, and the same time to put it out that the other technique. Otherwise, when we use the strip, to take the strip out and start to working with it, takes half an hour. When we use the strip, The most we had be put is like a 4,000 in one session against 1,000. And we know that some people put more than 1,000 in one session one by one, okay? But the statistics say after 1,000, the quality is going down. Why? Because the surgeon is a little bit tight. That's why we only take 1,000 by session, one by one.